afternoon and a very warm welcome to this webinar on AMR and COVID-19. How can Europe incentivize research and development to protect our future? Organised by MSD at the European Health Forum Gastein. My name is Jackie Davis. I will have the privilege of moderating our discussion this afternoon. I'm going to have a very interactive debate later on after some short context setters to provide some food for thought for our discussion. Antimicrobial resistance is one of the greatest challenges of our age, and COVID-19 has given us a foretaste of what could happen if we fail to meet that challenge. But although this issue has risen up the global agenda in recent years, there's been only limited action to address the fundamental economic challenges that have de-incentivized antimicrobial research and development. So, do policymakers need to move beyond traditional approaches to borrow from the title of this forum, dance with the elephant, and tackle the biggest issues which are most difficult to talk about and consider new approaches, i.e. put in place new market-based reforms to drive sustainable investment in antimicrobial R&D? If they do, what types of reform, what types of incentives are needed? And who needs to do what to address these issues? What is the role of the European Union, of national policy actors, of governments, healthcare payers, of industry, NGOs, and crucially, of multi-sector collaborations between all of them? And in particular, what can and should the EU do, notably, for example, through its forthcoming pharmaceutical strategy or its new EU for Health programme, to enable sustainable investment in the antimicrobial pipeline? That's what we're going to discuss over the next 90 minutes. Housekeeping first. This is, as I said, going to have two short context setters, then an interactive discussion with questions from me to our panel, and later on, I hope also from all of you. If you want to ask a question, just click on the Q&A button in the top right-hand corner of your screen. Type your question and hit enter. Could I ask you please to be brief so I can see at a glance what your question is and who it's for? Perhaps I could suggest Twitter length or less. If you want to share what you're hearing with the outside world, and we really do urge you to do so to get that AMR message out, please use the hashtags EHFG 2020 and hashtag AMR. Before I introduce our opening speakers, I want to get a snapshot of your views. Just a couple of questions that are going to appear on your screen in the polls button. We're going to open them in a minute, and I'd just like you to click on the answer you want and click submit. So let's have a look at that first question. What do you believe is the principal reason that there are so few antibiotics in development? Is it the scientific challenges, the regulatory barriers, the lack of appropriate incentives, or you don't know? If you could vote now. So for you, what is the principal reason why there are so few antibiotics in development? Scientific challenges, regulatory barriers, lack of appropriate incentives, or you don't know? And you press submit when you have voted. I will give that a couple more seconds, and then we will see what the results are. So let's have a look if we can. Let's close the voting on that one and have a look. So we have 21% of you think it's fundamentally a scientific challenge, 9% of you regulatory barriers, but a whopping 2/3 a lack of appropriate incentives, which is very good because that means we chose the right topic for our discussion this afternoon, because that's precisely what we are going to be focusing on. Okay, let's have a look at question number 2. What sort of incentives should EU policymakers prioritise to stimulate antimicrobial R&D? Should they be looking at grants and tax credits for R&D, so-called push incentives? Should they be looking at incentives for companies that bring new antibiotics to market, so-called pull incentives? Do they need both? Do they need neither of them? Or are you not sure which would really work? So is it push? Is it pull? Is it both? Is it none? Or you don't know? Press your answer. I've opened the voting. Press your answer and then press submit. And I'll give it again a couple of seconds before we see. So push, pull, both, none, don't know. And I'm going to, let's have a look now. Let's close the voting on that one and have a look at the results. So we have way out in front is push and pull. I suppose that was inevitable. But when asked to choose between push and pull, then far more of you, 22% wanted pull incentives and 6% talking about push incentives. So feeling we need a mixture of the two, but with the emphasis very much there, 1 in 5 of you on the pull incentives and relatively few of you on those push incentives. So thank you very much for voting. Now, to set the scene for our discussion, yesterday, I pre-recorded an interview with Cristian Silviu Busoy, who is a member of the European Parliament and chair of its Industry, Research and Energy Committee. He had hoped to be with us for this discussion this afternoon, but couldn't make it, had to withdraw at the 11th hour. So we decided to record this interview, and I asked him about the Parliament's work on tackling AMR and the decline in R&D. I should point out before we start, he was at an airport, so forgive a few little station announcements in the background in the first half of this interview. But let's hear what he had to say. So a very warm welcome, Mr. Busoy. Very good to talk to you. Perhaps we could start, if you could outline in general terms, the work that the European Parliament has been doing on antimicrobial resistance and why this becomes even more important at a time like this in the midst of the COVID-19 pandemic.
Well, thank you very much, first of all, to invite me to take part in the Gestern Health Forum session on AMR and COVID. And sorry for not being able to participate live, but very happy to have this conversation with you. First of all, I believe that antimicrobial resistance is an increasing public health threat worldwide, which no longer affects only humans, but every living organism from animals to the environment, and it's starting to have severe economic impact on our society. And the COVID-19 pandemic, unfortunately, revealed many of the inefficiencies of our health systems, the lack of preparedness, and also has deepened our delay in addressing antimicrobial resistance and shortages, for example. In European Parliament, to directly answer to your question, in the previous mandate, we showed continuously our worries since 2015. You remember at that moment, European Parliament adopted an important resolution on safer healthcare in Europe, improving patient safety and fighting antimicrobial resistance. It was called Pedicini report under the name of the main rapporteur, but I was the shadow rapporteur on behalf of European People's Party, EPP group, which is the largest political party in European Parliament. Then in 2017, the Commission adopted its action plan, a European One Health action plan against antimicrobial resistance, and we work in the European Parliament on this, both in ITRE committee, the committee that I'm president, I'm chair today, and ENVI committee. I'm also responsible as rapporteur now for the EU for Health program, the next program for health of European Union, 2021-2027. And I propose to my colleagues, and we'll vote soon, the final compromises, that antimicrobial resistance should remain a priority in this EU for Health program in order to increase our preparedness and also to fight more efficiently against these important healthcare threats. Also, we have the Horizon Europe, and Horizon Europe, the next framework program in research. It's very important for my committee, for ITRE committee. Also, we recognize as a political statement the need to increase funding for research and innovation in epidemiology and immunology, and we call for the developments various forms of sustainable incentive to support innovation. Last but not least, European Parliament also focused under the Pharmaceutical in the Environment report towards reducing discharge of pharmaceuticals in the environment and reducing wastage.
You talked about the funding for research, and I wondered in particular what the Parliament has been doing, what you think needs to be done to address the decline that we've seen in antimicrobial research and development. Is there more that can be done? What is the Parliament specifically pressing for in this area?
No, the Parliament is giving political direction And of course, it's supporting as a public policy decision the increased funding for research and innovation in epidemiology and immunology, encouraging stimulus in various forms of incentives, and reward mechanisms for R&D. Of course, we expected a little bit more on the next framework program in research from Horizon Europe. We proposed a budget of 120 billions. Then the situation changed after the well-known meeting day and night of heads of states and governments. The budget decreased quite significantly. Now we are in full negotiations between Parliament and the Council in order to see how we can do. And we have the final budget very soon because the program should start 1st of January. Absolutely. So we gave among priorities the direction to fund, to support funding for innovation and research in this area, and we try to assure the appropriate budget in order to achieve this.
So as you say, that fight goes on for the time being. You mentioned the issue of incentives earlier, and this is something I'll be discussing with our panel. In terms of your own view and the Parliament's view on the question of incentives to drive that innovation that's going to be so crucial if we are to meet this challenge, what is your view on what sort of incentives, what would work, what would be most effective?
Well, incentives are extremely important, and of course, stimulus and reward mechanisms, this kind of incentives are extremely well received by the community of researchers. The main incentive will be the political support. Mm-hmm. And it is clear what I presented you earlier with the resolution in the European Parliament, with the action plan proposed by European Commission, with the priority and the existence as a priority in both programs, Horizon Europe for Research and EU for Health, to implement and to fund initiatives, strategies, exchange of best practices, even for professionals, different programs of trainings. These are the kind of incentives that the European Parliament, with the support of European Commission, with the implementation of European Commission, already provided. But of course, this is not enough. The main action is in the hands of national governments, or in some member states of European Union, the regional or local authorities. But it's clear that the member states will have to mobilize to use these opportunities at the EU level, to use also and to take advantage of the political support and the general direction which is coming from European institutions, but to implement really good strategies and to take actions in terms of public policy in the area of health and also of their own schemes of funding in order to make a difference.
And you talked there about the EU for Health programme and some of those other issues. In terms of the forthcoming pharmaceutical strategy that we're waiting for from the Commission, what would you expect to see there in this area?
Well, EU for Health is very important because it will provide some funds and also some political support. And also Horizon Europe. So both could be considered, but in synergy, considered for fighting against antimicrobial resistance. I believe that the pharma strategy that we are all expecting, and I had some discussions with officials from European Commission, will also be a good opportunity in order to address market failures with regard to antibiotics, encourage sustainable investments for the discovery and development of new antimicrobials, including by promoting incentives and stimulus in order to develop new antimicrobials, because with the current framework, we don't have many stimulus, and what I discussed with the pharma industry during the years, they do not receive enough stimulus in order to invest billions to discover new antimicrobials. The reimbursement schemes and frameworks, philosophies in many of the EU countries will not incentivize them into to invest in discovering new antimicrobials. So pharma strategy should address also this. Of course, with the need to bring back to Europe or to put more emphasis in building in Europe the capabilities in production of new antimicrobials, because this is also be important also from a strategic point of view. But let's see what European Commission will propose. I believe and I hope this strategy will be very ambitious, but in the same time feasible, with feasible solutions, because it's extremely important to build in Europe a real capability in the pharma industry.
Thank you. And something you've been, as you mentioned at the beginning, fighting for, campaigning on, you and fellow members of the European Parliament for many years now. What we'll be discussing with our panel is how do we really accelerate that progress? How do we inject the urgency that's needed? And I'll be taking up a lot of those points you've made about the role of the EU in this, the role of the member states, and that key question of how do we most effectively incentivize the R&D, the innovation that's going to be needed to tackle this. So, Mr. Busoy, thank you so much for joining us. We're very grateful to you in the middle of a very hectic week, and we will report back to you on the outcome of our discussions this afternoon.
Thank you so much. I believe that in the context of COVID-19, also people understood that they need to respect the rules, and respecting the rules in the hospitals in the near future will also reduce the in-hospital infections and will help us to fight more effectively and against antimicrobial resistance. But of course, this is just one side. The rest is to act, to find new antimicrobials, to have a real strategy of policies and also of funding in order to achieve this. And I can assure you that antimicrobial resistance will remain a top priority in the European Parliament on the health agenda.
Thank you very much indeed, sir.
Thank you so much.
So there you have it, ladies and gentlemen. Cristian Silviu Busoy outlining the work the Parliament has done in this area and some of the challenges as he sees them. He talked about the role of key EU programs and what they can do to contribute this issue. But he also said the biggest thing they could do was political support. But he acknowledged that was not enough. He talked about the fact that for industry, they do not receive enough stimulus in order to invest in antimicrobials R&D. And that links very much to your voting, saying that 2/3 of you believe there was a lack of appropriate incentives. So during our discussion, I hope we can get into the detail of what incentives are needed, what would work best, and to set the context for us for that. We couldn't have anyone better to talk about incentivizing antibiotics R&D. What are we doing and where are the gaps? Delighted to welcome Christine Ordal, Senior Advisor at the Norwegian Institute of Public Health and co-lead of the Research and Innovation Work Package of EU JAMRAI, the EU's joint action on antimicrobial resistance and healthcare associated infections. Christine is going to take us through what we're doing, where the gaps are, and she'll be joining the panel afterwards. So if you have any questions for her, don't forget, please use that Q&A button to ask them. But Christine, over to you.
Thank you very much, Jackie. So my name is Christine Ordal. I work for the Norwegian Institute of Public Health, and I'm also the co-lead for research and innovation on the EU Joint Action on Antimicrobial Resistance and Healthcare-Associated Infections. It's a pleasure to be with you today. So I should firstly say that all the views in this presentation do not represent the views of any government, and any mistake that's made is purely my own. So I want to talk to you firstly about a worrying trend in Europe. And there's a worrying trend of delayed availability for new antibiotics in Europe. This means that Europeans do not necessarily have access to the most appropriate antibiotics. I'm going to take you through two cases. So in 2017, the World Health Organization, WHO, published a list of priority pathogens, those pathogens that need new antibiotics because we see infections emerging where we don't have effective antibiotics. There's 3 categories of priority pathogens, and the top is critical. WHO has also published, looked at the candidates in the antibiotic pipeline, and gone through and done an assessment to see which of these antibiotic candidates are innovative, which ones are new. And so the first case I'm going to talk about, oh, I've lost my slides,
I'm sure
I can talk about it. It's called,
there we are.
there it is, Meropenem vaborbactam. So I'm not going to get too technical on this, but Meropenem vaborbactam is an innovative antibiotic against a critical priority pathogen. So one of the pathogens that we desperately need new antibiotics for. It's been developed by an American company, a medium-sized American company, and it received American regulatory approval in 2017, European regulatory approval in 2018, and unfortunately it went bankrupt in 2019. So the company is now under restructuring. So this innovative antibiotic for a critical priority pathogen is only marketed in a handful of European countries, even almost after 2 years on the market. So that means that if you're located in Norway, like I am, or Sweden, or Netherlands, or Germany, you might not have access to this antibiotic if you need it as a patient. The second case is an antibiotic that has not yet been approved. It's in the last stage of human clinical trials. It's called Taniborbactam cefepime. This is also for a critical priority pathogen. It's considered innovative by the WHO. It's being developed by a small American company, and it has no European commercialization partner as of yet. But 2 years ago, this same company secured a licensing agreement with a Chinese company. So it has a licensing agreement for China, South Korea, and Southeast Asia. And earlier this year, it had a licensing agreement with GARD-P, the Global Antibiotic Research and Development Partnership, which ensures that they have a license for most low and lower middle income countries. So that means if this antibiotic is approved, an important new antibiotic, Europe is not amongst the first 3 regions of the world to get access to this important antibiotic. And the reason for that is that the European market is less attractive because of low sales and low prices. So low sales is a problem we want to have. We are very happy that multi-drug resistance is still thankfully very rare. So this is the latest ECDC report on surveillance in Europe. And the pathogens in the left column are those that are identified as critical WHO priority pathogens. And they're emerging resistance to a drug class, a very important drug class called carbapenems. But they're not only resistant to carbapenems, they're also resistant to other classes. You can see the number in the right column. And what that means is, in order to treat these patients with a new antibiotic, the number of patients that actually have multi-drug resistance is relatively small, which is great. That's exactly what we want. But we're talking about 700 patients or up to 2,800 patients. That's a very small market. And this is exactly the way we want to keep it. We want to make sure that new antibiotics are saved as a last resort and only used for those patients that need them. Now, that's half of the equation. So if we're looking at revenues, you're looking at the number of patients times the price. And for reasons that are quite complicated regarding clinical evidence, almost all new antibiotics enter the European markets at the same prices as older generic antibiotics. So what happens, the result of that, is that, of course, disincentivizes innovators. So this is a report that was published in January 2018. It looked at the largest R&D divisions and the largest market presence of antibiotic innovators. So it only looked at 19 companies, but out of those, 7, now less than 3 years later, have either left the market or dramatically downsized their activities. And that includes 2 large pharmaceutical companies. Now, you might think that, okay, that's not a problem that large pharmaceutical companies are leaving this market, because there still are small companies left. There's 7 here, but of course, there's a lot of small companies that weren't included in this report. But the problem is that large companies ensure global access. They have economies of scale. They know the regulatory requirements. They have the distribution networks. Large pharmaceutical companies ensure that their products are accessible to patients. So that is a big problem. So there's many reports that have been published to look at the problem of antibiotic innovation. And thankfully, they've all come up with relatively similar recommendations. And you're already familiar with these because you voted on them. And it sounds like you're quite well acquainted with them because you've chosen many of the outcomes that these reports have identified. So the first recommendation is to invest in R&D. And luckily, there's been tremendous support in this area. Since these reports have been published, there's been 4 new organizations established. That includes CARB-X, which finances early-stage antibiotic development, the privately funded Novo Repair Fund, GARD-P that ensures that there's new antibiotics for low and middle-income country needs, and then also recently in July, 20 of the largest pharmaceutical companies came together and said that they were going to invest $1 billion in late-stage antibiotic development through the AMR Action Fund. So this has been quite successful, and we must say that this call for investment has been heard. But it's the second, as you rightly identified through the quiz, that to fix the market by rewarding innovation and availability rather than sales.
We need to be fairly brief, Christine.
Okay, sorry. So countries must be willing to pay for antibiotics that are not going to be used in patients today. And so there's 2 countries that have initiated pilots here, the UK and Sweden. This is the Swedish pilot, and it looks at a guaranteed annual revenue. So the payment continues as usual, and at the end of the year, if the guaranteed annual revenue has not been met, that means that the Swedish government will top up that amount. Now, this is great. This is for Swedish patients to ensure that they have access to the newest antibiotics. There's few of them, but they want to make sure that the Swedes have access. So the UK is similar, except for they're paying an annual revenue for as much or as little of the antibiotic as they use, but they are willing to pay a higher amount to ensure that they're also incentivizing innovation. Now, Germany has also decided to implement a pull mechanism, and the German mechanism is different in the fact that they are willing to award orphan status to new antibiotics. So they're allowing for higher prices. And this, of course, also can give more revenues to antibiotic innovators. But of course, this might also lead to higher prices, as we've seen for other antibiotics or other products. But one opportunity that recently came up was President von der Leyen's State of the Union address, where she pledged to build a European BARDA. For those of you who aren't aware of BARDA, it's an American agency that's been established about 15 years ago, and it's an agency for biomedical advanced research and development. And this agency, the aim is to enhance Europe's capacity to respond to cross-border threats. So, potentially, we have an opportunity. So through our work at the EU Joint Action, we've heard that many countries would like to have a European-level pull mechanism. Between 2010 and 2019, the American BARDA supported antibiotic innovation with more than $1 billion. So could there be a European equivalent? A European equivalent that could make an annual revenue guarantee, like Sweden, for EMA-defined important antibiotics in order to ensure that all European countries have access. This, of course, would be completely independent of national pricing and reimbursement. It would simply be a top-up payment. So this is a potential solution and hopefully fruit for discussion regarding how an EU BARDA might develop. Thank you very much for your time.
Thank you very much indeed, Christine. And if I could immediately just follow up with one question before I introduce the rest of our panel. Which do you think is the most feasible of the options you've outlined? You've talked about the different pilots, what's being done. Which for you is most realistic?
I think the German model is probably the most realistic to allow for higher prices because it's an existing mechanism today. But I don't think it's the fairest mechanism because not all countries will have the financial abilities to meet these higher prices. And so therefore we might see disparities in access.
And who's going to pay for all this? How are we going to finance it?
Well, the financing has to come from the governments. In the end, you can have a lot of different financing mechanisms, but in the end, if the healthcare is a government public resource, it's got to come from the public.
Okay, we're going to discuss all of this in a lot more detail with our panel. Let me bring them in now, and I hope they will magically appear on your screens as I do. Joining Christine and I to discuss this, I'm delighted to welcome Jeremy Knox, who is Policy and Advocacy Lead on AMR at the Wellcome Trust in the UK. And Wellcome Trust, of course, a leading philanthropic research and innovation funder. We have Janelle Krishnamurthy, Associate Vice President, Global Policy, Communications and Population Health at MSD, and John Ryan, Director of the Public Health, Country Knowledge and Crisis Management Directorate in the European Commission's Directorate General for Health and Food Safety, better known to those who are Brussels-based as DG Santé. So a warm welcome. I'm seeing John. I'm not yet seeing our other speakers. I don't know whether we have a issue here. I'm trying to find out, or whether, as at the moment, I can only see you, John. While we wait for the others to appear, can you hear me, John?
Yes.
Yes, perfect. Okay, let me come to you. Jeremy is joining us. Well done, Jeremy. Very warm welcome, John. And then I'll come to you a bit later because I'd like you to hear the different inputs from the stakeholders and then react to them. And we have Janelle has also joined us. So well done, everyone. Technology does not let us down. Jeremy, if I could turn to you first. Can you just outline briefly for us what Wellcome is doing to tackle this antimicrobial innovation challenge?
Thank you, Jackie. It's great to be taking part today, and apologies for a slight heart-stopping moment there where my camera wouldn't activate. So Wellcome, we've been committed to AMR as one of our organisational priorities for a number of years now, and our support for antibiotic R&D has really been a very key part of that commitment. Integral to this has been our support for Carbex, which I know has been mentioned already. It was established just over 4 years ago in partnership with BARDA. And it has, of course, grown now to also draw in support from the UK and German governments and also the Gates Foundation. Carbex has been instrumental, I think, in helping support early stage research in the antibiotic space. It's really been a crucial first step in helping get a sorely neglected R&D field get back on its feet. But at Wellcome, we recognise that supporting Carbex by itself won't be enough to fix the antibiotics pipeline. We need the much broader suite of interventions that Christine just described so well. So we've been looking at ways that we can support the ever more urgent calls for governments to act more ambitiously, more meaningfully, to act and ensure that we have a sustainable R&D system. We've also been looking at how we can do more to support research beyond the scope of Carbex. Philanthropies like Wellcome can't prop up the pipeline by ourselves, but we do see there is more we can do to support antibiotic R&D in a very measured and appropriate way. We've been doing a lot of work to explore what this looks like, and that's why it's very interesting to see initiatives like the AMR Action Fund take shape.
Can you just tell us a little bit more about that fund? I know you're involved. I think the WHO, the European Investment Bank is involved, and many, many pharma companies. Tell us a little bit more about what it's doing to contribute to meeting this challenge.
Sure. So it's a very new initiative. It's a new impact investment fund launched initially by a significant number of pharmaceutical companies, some 20 or so companies acting together, which will provide targeted support for antibiotic developers as they head into the later stages of antibiotic development. So phase 2 R&D and beyond. It's already raised close to $1 billion from company commitments, which means it's hitting that point of critical mass where it can support a kind of a fairly significant portfolio of the strongest assets coming into the antibiotics pipeline, probably up to about 15, which I think gives it a good chance of getting at least a couple of products to the market over the next 10 years or so. Crucially, and this is why it's been so interesting from Wellcome's perspective and why we've been so glad to be involved from the very kind of early formative discussions with companies about this, it will be able to fund projects and small companies that normal venture capital funders currently won't touch, either because projects are too high risk or because the returns are simply kind of expected to be too low. So it fills this urgent funding gap we've been seeing emerge, this kind of growing, widening valley of death for antibiotic development, as small biotechs, once they graduate from phase 1 into CARB-X and kind of leave CARB-X supports, they don't have anywhere to turn to find financing or development partners or the technical support they need.
Yeah.
So really this kind of provides a lifeline, avoids that cliff edge we've been seeing emerge. It won't solve the problems by itself, but it's a really kind of big, important step towards a kind of a stronger R&D ecosystem in the coming years.
Thank you. So on that side, you're contributing, and also on the other side, those involved are contributing to this debate that we're having now about the market conditions that we need. Let me bring in at this point, and we'll come back on these topics later on, also this question of multi-sectoral collaboration of the type that you're involved in. Let me turn to Janelle now, Janelle Krishnamurthy. MSD's role in all of this. Janelle, for you, can you just outline briefly what MSD is doing in this area to tackle this decline in antimicrobial R&D and deliver this innovation, which we've heard already so many times is so important for patients?
Yes, Jackie, and let me just thank you and everyone that's participating today and everyone that's in the audience on this public health crisis that we're discussing right now. MSD has been involved in infectious disease for over 100 years. And this is something we have been committed to. We've developed some of the first antibiotics that were around, starting with penicillin that saved millions during World War II. We're unfortunately one of the last of few large pharmaceutical companies that are engaging in R&D to develop the new medicines and vaccines to prevent and treat bacterial infections. We are going everything from in-house discovery efforts and clinical development programs. And so we also cover this with vaccines for animals as well. So also looking at the prevention side of this. So really taking a One Health approach. As Jeremy mentioned, we were one of the proponents of the AMR Action Fund. We really looked at this as a bridge because the time to act is now. I mean, how many more companies? I think Christine did a unfortunately lovely job of drawing the picture of all the companies that are withdrawing, that are not engaging in this space. And so this is meant to give us a little more time, a little more antibiotics to be a bridge so that governments have time to put in the incentives in place and fix this marketplace so that more companies will join us in this venture.
Thank you very much indeed. And in terms of these incentives, 67% of our audience identified a lack of appropriate incentives as the most important issue. There was a bit of a mix about whether it's push or pull or both. Not surprisingly, most saying we need both, but more of an emphasis on the pull than the push. For you, in terms of what's really needed, what would work, what are your thoughts here?
You know, I think this is a very complex issue, right? I mean, we want to be stewards of these wonderful, precious antibiotics that we develop. And when you talk about it on the market, so you develop it, then we say, do not use them. Please hold them back until you actually need them. Because once you use them, we know resistance starts, right? And so with this complex, quandrum that we're in, there's not going to be this silver bullet of one incentive fix. And then also, as we've talked, it's a lovely diverse group of companies and biotechs and small folks that are in this system. So they're going to need different incentives to make this fix the entire continuum. So when you ask me, I apologize, Jackie, that I can't give that one answer. And I think if there was, governments would have done it by now. We wouldn't be here. But I do think it is a mix. It's the mix of the push incentive where we're looking at grants and refundable tax credits to reduce that risk of early investment of antibiotic R&D. But then you're looking at things like the pool, the partially delinked mechanisms. For example, market entry rewards or transferable exclusivity to reward that really innovation earlier in the product's life cycle when you're really looking at hold it on, do not use that sparingly. And then lastly, looking at the reimbursement and HTA reforms, because this is something societal values. How do you value this antibiotic, this precious, that we're not going to use? And is that assigned the value it really does contribute to public health? So it has to be a diverse suite of incentives, as we like to say.
I'd like to come back on that value question in a little while, but let's complete the picture. John, before we talk about the role of the EU in all of this, and later on, I hope, delve a bit more into, for example, the pharmaceutical strategy and what it can do. In terms of the challenge here, we've heard Christine outline, and then Janelle and Jeremy, why we face such a difficulty in this area. What for you are the key challenges that need to be addressed? Did you agree? I don't know whether you voted in the poll, but if you did you agree with the audience's opinion that it was the lack of incentives? How did you vote?
I think that there are two aspects to the problem. First of all, the aspect of new antibiotics and how do we develop these and under what conditions. That's one point. We've said a lot already about new business models and how to encourage and incentivize and reward the production of these products. But on the other side as well, there is also an issue regarding the use of the products once they are produced. And this is what we call the stewardship discussion. And I think it's important to advance on both sides. Our colleague from the European Parliament, Christian Boussoy, mentioned as he was closing the issue of infection control and patient safety. And I think there's, as we know, there's a huge amount to be done in Europe in respect of hospital-acquired infections and how those can be controlled. So I think it's not just a question of putting all our money and all our cards and all our attention on the development of new antimicrobial agents and figuring out the business model and so on. It's not a question of only of working out how these new products could be financed and to incentivize the industry to produce them. But there are many other aspects on how to ensure the stewardship of existing tools, reducing the opportunities for infections to take place in healthcare settings. And finally, I would mention as well, of course, that we in the Commission take a One Health approach, which means that all of the tools which we need to take, for example, on environmental pollution with antimicrobial agents, medicines passing into the wastewater systems, for example, but also how to control the use of antibiotics in the veterinary medicine field is an area where we have been able to, I think, take some very, very strong measures in terms of legislation on the use of antibiotics in the veterinary field. So it's quite a complex area, as you said, and I think the issue which you've chosen for today's discussion on incentivization of R&D is just one part of this.
Indeed, but indeed linking that to your stewardship point and links back to what Christine said, because as she said, we want good stewardship. We don't want to use these new antibiotics. They should be a last resort. And if they're a last resort, that reduces the incentive to invest in them. So we do need the stewardship issue and the incentives issue. Do they not go hand in hand, John? But we'll come back to that. But John, first, in terms of the EU's role here, we heard the member of the European Parliament, Mr. Boussoy, talking about the key EU programs, and indeed the consultation for the pharmaceutical strategy that we're expecting soon does talk about filling market gaps, and it gives the example of antimicrobials as a key issue that it wants to address in terms of delivering more safe and affordable medicines to patients. So what role do you see for yourself, for the Commission, for the EU more generally in all of this?
So the European Union, in terms of pharmaceutical policy, has a rather strong hand to play, both in terms of the evaluation of new products, the research which we encourage into new medicinal products, and also the general policy issues. I think a good example is probably the experience we're living through at the moment in terms of the development and procurement of vaccines for COVID. I think if you had told anybody 6 months ago, before the COVID outbreak, that the European Union would be procuring jointly for 27 member states and signing advance purchase agreements simultaneously with all potential producers of pandemic vaccine, and that the member states would be asking us to do more and not less. I personally would have had difficulty in believing that fairy story, but it's happening. It's happened.
And can we draw, John, do you think, any lessons from that as we look, because as I mentioned earlier, many people saying, you know, COVID has shown us what will happen if we don't address this issue. And this one we know about. We didn't know about COVID. We know this is coming towards us. Do you draw any lessons from that for when it comes to tackling antimicrobial resistance?
Yes, absolutely. I draw lessons, and I think the Commission is going to draw lessons. There will be a lessons learned package which we'll be producing before the end of November, which will reinforce the mandate of the ECDC, our framework legislation on cross-border health threats, and the mandate of the European agency. So we're hoping to try and learn some short-term lessons from these three for these three pieces of legislation. Secondly, there will be the pharma strategy, which you mentioned as well, which I can't unfortunately say very much about because it hasn't been written yet. So it will be difficult to just.
I was going to ask you for a sneak preview.
Well, you can ask, but unfortunately I can't help you there. But I think there will be a consultation which will be launched fairly quickly, and you'll be able to, I hope, as a community, indicate these areas of our greatest need. AMR is not the only area, of course. We have issues around innovative medicines and new types of medicines which are coming on stream, and not alone the fact that they're coming on stream, but how to pay for them. And one general remark I'd make in terms of how to pay for them is that I think there's a great underestimation at the moment of the economic impact of COVID.
Yeah.
I'm not responsible for economics, thankfully, but I am responsible for public health. And one thing that does worry me is the fact that, you know, I see the gross national income, the GNI of countries reducing by 10, 12% at the moment. And I just ask myself, how will countries be able to afford even the pre-existing levels of healthcare?
Yeah.
And not necessarily what people are expecting for the future.
Sure. But Janelle, if I could come to you and just ask, there is going to be a cost issue. Budgets are going to be tight, but the cost in this area of not finding an answer to this challenge. I mean, from your perspective, what happens if we fail to solve this?
I mean, unfortunately, I think as Christine and Jeremy have cited, there have been many papers, many things written talking about this is coming, the tsunami is coming. I think, you know, we're talking about Dancing with the Elephant. We have lobsters. Like there is all kinds of warning signals coming. It's just, it's not ever what's going to grab the headlines, unfortunately. And so what is going to happen, and I think we have all kinds of scenarios here in the United States at Johns Hopkins University, every winter we have the doctors come and say, we have people with bacterial resistance pneumonia, and all we can do is hope that they beat it. And it just, I think it's that silent killer. And it's once the MSDs and the other companies that are the last big ones that are here, I hope it doesn't come to that they leave the field, that people see that this really is the problem.
Jeremy, I think you want to come in.
Yeah, thank you, Jackie. So I think the affordability point is a really important one. And I think Christine set it out very well. I think John's point around the kind of the fiscal squeeze that's coming as a result of COVID, I think no one's really properly gripped that yet. And I think undoubtedly it's going to have an impact on budget. But I think we need to put things into perspective here. And really the type of solutions we're talking about in the antibiotics market are correcting really decades of kind of very little growth in the value afforded to antibiotics. This is about turning a market which at the moment is enormously undervalued into one that is slightly more fairly valued. This is not about creating a market where we have drugs at kind of blockbuster values and the sort of overinflated prices we maybe associate with other areas of medicine. This is about simply trying to reflect the value of antibiotics to patients who need, and reflecting the value of having these new drugs available in healthcare systems, and getting a bit more money, just enough money to get into the system to get it working.
Can I just ask why it's undervalued? We've had a project, there's a Drive AB project, which the EU has been working on with FPO, representing the pharmaceutical industry, and they've been looking at this question of the value that society attaches, the value also, that health payers attach and so on. Janelle mentioned it earlier. Why briefly do you think it is undervalued, and what can we do about it? And Christine, I know you want to come in on that, and Janelle, I'll bring you in on that point.
So I think, Christine and Janelle will be kind of better versed on a lot of the technical aspects than I am. But I think the way we would see it, there are serious barriers in terms of the volume issue. The fact that actually for many of these new products, the predictable market is very, very small, and therefore we need to be incentivizing potentially very small markets or very small volumes. I think also in European markets, there is a question of the HTA processes, the health technology assessments, and the fact that simply the way these processes, these very sophisticated, normally very good and rational processes for assessing the value of medicines, they simply don't work for antibiotics. So an antibiotic comes to market with only non-inferiority data, for instance, and it's very, very hard to plug that information into an HTA process and come out with a meaningful value. I know that NICE in the UK is looking at the valuation process as part of the work on the NHS England pilot. And I think that will hopefully start setting a precedent for other HTA agencies around Europe to really look at how to actually define the value of antibiotics in a rational way that isn't necessarily the established process used in other areas.
Thank you. Christine, you wanted to come in.
Yeah, I just wanted to support John in the fact that absolutely there are many European countries that the best utilization of their scarce funds would be to improve infection prevention and control and antibiotic stewardship. Absolutely. And I think we're going to learn a lot from the UK and the Swedish pilots. And now, of course, the US has proposed legislation for the Pasteur for their own pull incentive. But I do think that if there was a signal from the European Commission that this was going to, start a process and start looking at a design and have conversations, building upon the evidence, I do think that would be seen positively from the private sector. And that must be from countries like my own country in Norway, where, we use 27% of the antibiotics we use are Fleming's penicillin. So because we have very good IPC in place. So I mean, those are the most important things to get in place. But for the richer countries that have these antibiotics as an insurance policy, like what Sweden has done, I think it would be very helpful to the market if there could be a signal from the European Commission or the appropriate committee to say, you know what, we're going to look at this. It's not going to happen tomorrow, but this is a process that now we're looking at and committing to design and see what can happen.
Thank you, John. I'll give you a chance to respond on that in a moment. But Janelle, can I just briefly come back to this value question and what the problem is here and why society perhaps undervalues antibiotics, despite what you've been talking about, the consequences if we don't have them?
I think it's twofold. I think from your patient side of things, you get the drug that your doctor prescribes you, and if you get better, you're better and you go away and you're not, you don't realize it. Or you don't get better and you possibly die. And then again, there's not going to be, it was that I didn't have my antibiotic. And there is this public discourse on we need to have antibiotics. It's just not that kind of issue. It's more, I would say, academic to a certain degree. So then it really does fall on government officials, which is much more difficult because obviously there's constituencies and patient groups on many other issues that are much more vocal on this. And I think I do very much respect what John was saying, that during COVID, it maybe has, the visibility of secondary infections for antibiotics has come about. However, at the same time, fiscal constraints are really real for governments. And so how do you, keep the stores open and at the same time deal with these major public health issues?
Thank you, John. I don't know whether you want to comment on that, but if I could come back to you on this point Christine made about the signal that she's looking for. Would you echo that? Do you see a role? How do you see your role? And you talked about budget constraints. What about the legislative framework? Is there something you believe that can be done in that area? So here, of course, we're talking then much more about the pull end of this than the push end, given the budget constraints. So can you send a signal? And do we need to think about the legislative framework? Same question to you all about the EU's role and what they can do, what you would like to see. And then I'll take a few questions from the audience.
Yeah, so I think one of the purposes of the pharmaceutical strategy, which is being developed and on which you'll have the opportunity to comment very shortly, is the changes that we can make in the legislative regime in particular, but also in the industrial policy and in the linkage between research policy and industrial policy and legislation. All things are linked. There's no point in pouring a huge amount of money into research. I mean, just in passing, I would say that in recent years, the Commission has invested over 1.3 billion euros into AMR-related research and several hundred million in loans for research. That's more than the 7-year budget for the entire health program. So, I mean, it's not like we've been neglecting this from a research point of view, but I think the point that changing legislation is more complex because you've got to identify where problems are, where improvements can be made. And then if you're talking about issues like tax breaks and so on, it's a different question altogether, because that's dealt with on a different level.
Yeah.
So, it's the member states who decide how much tax they're going to charge a pharmaceutical company. So it's a complex question, but we are developing this pharmaceutical strategy, and one of the big challenges will be, of course, sustainability of our pharmaceutical industry in Europe. One of the key lessons we've learned over the last few months is that there's no point being in the middle of a pandemic and then discovering that the essential pharmaceutical ingredients are all coming from the area of the origin of the pandemic. So that was a major problem, and I think a wake-up call to many of our heads of government when they suddenly realized that the pharmaceutical industry was producing on the other side of the world. So that will certainly be one of the topics in the pharmaceutical strategy, if I'm allowed to guess. And the other point I wanted to make is more a political point, because during the State of the Union address by the President of the Commission, Ursula von der Leyen, she announced that there would be an initiative taken on what's commonly called an EU BARDA. And I think somebody kindly explained earlier on what a BARDA was, but it's basically, it was also a political response, if I remember correctly, to the fact that there was offshore production of pharmaceuticals away from the United States. And when they went through a previous pandemic, a flu pandemic, they discovered that all the vaccines were being produced somewhere else. Now, they may have had other considerations as well, like CBRN threats and that sort of thing. But I know that they have invested massively in the context of the US BARDA. When such a system is established here, we'll have to look at our particular setting in Europe and to see what the needs are here and what would make sense to do together. All I can say is that if there are health threats coming our way in the foreseeable future, one of those will certainly be antimicrobial resistance. It is antimicrobial resistance already. It's not going to get better unless we do something about it. So I think BARDA will have on its plate, immediately it's set up, it will have this challenge of antimicrobial resistance.
Thank you. Christine, can I just turn to you and perhaps bring in the context of the work in EU JAMRAI in terms of the role of the European Union here and what a supportive legislative framework might look like. John's saying there this is something they're looking at. You've all underlined how complex this is. But drawing on that work, what sort of conclusions have you been drawing about that?
Well, what we've done as a part of the European Joint Action is we've gone and interviewed 11 countries in Europe to understand what is their appetite for incentives and to understand the barriers. And I think that we all probably can agree that setting up their own pilot is quite a big endeavor. And especially if you're a smaller country, it's much more attractive if we can look at it from a European perspective. And so we've heard that most of the countries, not all of them, would like to have some sort of European-wide regional mechanism. But hopefully, now I'm not a lawyer, and I'm not very well versed in European law, so I apologize. But
I think that's the lawyers on this panel.
Yeah. So, but I would hope that anything that we could come up with would not require a legal change initially, because certainly it's got to be tested. And you know, we're going to find out more by trying something and seeing how it works, and then tweaking it and updating and adjusting as we go along. So any kind of mechanism will need some sort of flexibility. And I think potentially Jeremy knows more about if there was legislative changes for the UK's pilot, but I think that we need that kind of flexibility going forward.
Jeremy, a thought from you, and indeed part of your work, of those of you all involved in the AMR Action Fund, is encouraging governments to create these conditions. So when we look at the role of the EU and what they could do through the pharma strategy, through legislation, what do you think they need to do? Same question then to you, Janelle, and then we'll take a couple of audience questions. Jeremy, your mic is off at the moment. There we are.
Sorry, I was trying to, it's a bit slow to turn off. So I think so. One important point to kind of make is we're welcome. We've been involved in the AMR Action Fund. We're still not, we haven't exactly confirmed how we'll be participating going forward. So there's just that caveat there. I think in terms of the changes, I think I'd agree with a lot of what's been said so far around the need for these new reimbursement, new procurement models, at least at a country level or at a European level. I think in the UK, they've been able to do it in a relatively, I say that very advisedly, a relatively straightforward way because of the way that the NHS in England is organised. It's one of the most kind of centralised, monolithic healthcare systems in the world, although anyone who's worked in it will tell you that it is not simple, it's not straightforward to navigate. So let's not underestimate the complexity of what they're trying to do. But I think trying to find ways that countries can create these new reimbursement models that work for their own health system, that work for their patients' interests, and don't create unrealistic administrative burdens. I think that's really crucial, and hopefully we will see kind of a rapid sharing of learning. I think the point of caution I'd give is that I think we don't have the time to wait for kind of multiple pilots to run over a 2 or 3 year period. So for instance, the UK pilot is moving pretty quickly, but it's going to be a kind of a 2 year period to actually get the contracts up and running, to get the new procurement arrangements in place. If all governments kind of wait for the NHS in England to go through their pilot, then the next country out of the blocks waits another 2 years, we're just going to push the can further and further up the road. We know broadly what needs to be done. We know the nature of the problem. We know the dimensions of the solutions. And we also know that this is urgent. If we kind of make as little progress that's been made in the past 5 years, in the next 5 years, then the kind of work of the Action Fund, the work of CARB-X will count for naught, because we won't have the kind of a crop of antibiotics coming through in a kind of perpetual way that we really need to have. We need to have more pace going into whatever we try. Some things will fail, but we just need to act more urgently.
Thank you very much. And Janelle, a comment from you too on the role of the EU. I mean, I was struck earlier when talking to MEP Buzoy. He said to me yesterday, and you heard him say, yes, there are things we can do, and he outlined the programs. He said the main action is in the hands of national governments and regional authorities. But John there saying there is a lot we can do. I think you have a general consensus that Europe has a key role to play. What for you are the priority actions at EU and national level if we are to address this? As everyone's saying, it's complex, but we know, Jeremy just said, we broadly know what we need to do.
Yeah. You know, I think you're exactly right. And the EU, I think if you're asking me what could be the most meaningful right now, because I think John did say they have done a lot. Many places have done a lot. We do not want to, and many times more in the push incentive area and doing the research and development, which is critical. And that's where we need to start. The US did that. A lot of places have done that. It's looking at that continuum. And so now I'd say for the EU wide, really looking at the pharmaceutical strategy, as John, you mentioned earlier, I think that is an ideal place where the Commission could submit an ambitious legislative proposal, to Parliament and the Council, designed to really promote the development of novel antibiotics. I think that is key. With also, we need country action too. To what Jeremy said, time is short. I mean, we see it all right now in front of us. This is something where we have to walk and chew gum, and people need to, and we need to have our pilots going as well. And that's great and really important. But I mean, time is now, and I think we're also past just signals. I appreciate that. But I mean, in the US, as Christine said, we have Pasteur that's getting an incentive. We before had Disarm, and we've had all kinds. But I mean, companies understand these are all just proposals that go out there and then they don't go over the finish line. So really appreciative of all the effort that's going, but really have to emphasize that bold action is needed now.
Thank you. Let's take a few questions from the audience, and they're not specific, but let me just, so please do indicate to me if you think you can come in on them, because they're not directed specifically. But a first question here, as Janelle mentioned, One Health, could the speakers expand more on how the One Health approach, zoonoses, can be built more into the incentivizing process, links with the One Health European Joint Programme, etc.? Who might be able to come in and answer or pick up on that one? Anyone help me with that one? Christine.
None of the new antibiotics will ever be used in animals. So now that we see new antibiotics coming, that's a primary stewardship mechanism, and that animals, unfortunately, will have to be treated with the older antibiotics. And really working on the One Health perspective is ensuring that new vaccines are developed, as well as money being invested in infection prevention and control.
Anybody else want to come in on that? John?
I just want to pay tribute to our Norwegian colleague, Christine, because her country, I think, is a world example of how to improve stewardship on a One Health basis. You know that for those of you online who like fish, Norway is famous for its salmon, its farmed salmon. And one of the major achievements, I think, of the Norwegian government was to recognize that the use of antibiotics in the growing of, or the what would you say, the growing of farmed salmon was a major public health issue, and they managed to eliminate the use of antibiotics. So when I'm not talking about new antibiotics here, I'm talking about the existing ones, but they really made a major step forward, I think, in making sure that the veterinary sector, even with the very important economic consequences, because you can imagine how difficult it was to convince the fish industry in Norway, which is a big industry, that it was in their commercial interest to vaccinate rather than to give antibiotics. So I think there's a lot, as I said, we can do to join up our thinking between the veterinary side and the human health side.
Two questions that are linked. One is, what about incentivizing and facilitating the entrance of rapid diagnostics to optimize the use of antibiotics and reduce the rate at which resistance is created? And another one, what if new and different antimicrobials are not the answer? to AMR in the long run? How to balance innovation in antibiotics with research into alternative pathways such as prevention and other treatment? They're sort of exploring this wider landscape, which is why I've put the two together. Chanel, can you come in on that? And then Jeremy.
Absolutely. I think, it's a combination. And I think we have always been very strong, and the community has been very strong on talking about stewardship. And you only get prescribed the right drug at the right time for the right duration. And so that is absolutely the foundation of anything that we should be doing. I think we have found through all these years that that's not the only way. We still need the development. Unfortunately, these superbugs and these things happen. We're still going to need antibiotics. So novel antibiotics. So that will not solve the whole issue. I think secondly, you were saying, I'm trying to remember your second part of that, Jackie.
The second part of the question was how to balance, what if new antimicrobials are not the answer? Balancing innovation in antibiotics with research into alternative pathways, prevention, go back to the diagnostics point, and other treatments.
Diagnostics.
What if this
yes.
said there was no silver bullet, but what if it's not the answer at all?
So no, well, I think let me get a tackle on that diagnostics part, which I think is also a very key part here. I know any incentive system MSD has been supportive of, has always linked in that legislation or any proposal that rapid diagnostics are also being produced at the same time, because that is key. And that's key also for the entire health system. So the hospitals need to, because that's costly, changing the panels out and having the diagnostics is critical here. So I think that's important. And then to the point of, if the antibiotics are not the solution, well, they're not totally the solution. The best part, I mean, we would say as a One Health company, vaccines is really important. And that is why we produce, some of the major vaccines that help the Norwegians get to where they were with our animals, and trying to keep them healthy in the first place. And that would be the same with people. So I think, again, it's a combination of things.
Jeremy, you wanted to come in here.
Yeah, I'd agree with a lot of that. I think that with AMR, there's no kind of single shot on goal that we need. It's, as we're seeing with COVID, I mean, with the COVID response, it's abundantly clear that it's not a question of a vaccine or therapeutics or a test and trace strategy. It's about doing all those things in parallel and more. And I think AMR is exactly the same. So it's not a question necessarily of all of the either ors. However, I think the point about antibiotics is that really, we've been thinking about this long and hard at Wellcome, going back to when we initiated our first strategy on this. And really, we don't see any version of the kind of the future environment where we don't have a dependency on a healthy, sustainable, continuing pipeline of antibiotic treatments. That's not to say there won't be other valuable things, but there is no alternative that we see to that being the thing. And that's why we need to really prioritize it. And the antibiotics R&D space is in such a position that we need to be really prioritizing that over the next kind of 5 to 10 years. We need to be making great progress in bringing new antibiotics to market, establishing the foundations of a solid R&D system to make sure we have that continuing supply going forward. On the specific point about diagnostics, I think, yes, they are a key part of stewardship. They are a really underutilized resource at the moment in the AMR space. I think there's a lot of focus that's been given to the technical questions, the question of bringing, of what are the technical challenges to bring rapid diagnostics that could be useful to market. But there's also an economic question. How do we incentivize the uptake of those things? At the moment, particularly, for instance, when you're prescribing very kind of low price antibiotics in primary care, the incentives to insert a diagnostic into that sort of process, that's really, really a tough nut to crack. So we need to think about the kind of a health systems approach, the type of things we can do at a health systems level to incentivize doctors to use those diagnostics once they become available. That's not a trivial factor.
Okay, one more question from the audience, and then I want to come back a bit more to how you all see your own roles. We've talked about the role of the EU in this, but how you all see your own roles. We haven't talked so much about the patient's voice in all of this. Come back on that. But on the topic of value evaluation, question from the audience: are there trade-offs to be made in investment incentives also between antimicrobials and vaccines for pathogens associated with AMR and other health technology? Can anybody help on that one? A lot of frowns, a lot of thinking going on. Christine, you leant forward. Don't do that because
Well, I can just say that Norway has actually approved to look at HTA and the value of both antibiotics, societal value, and vaccines. And I think this is obviously vaccines have a tremendous value in avoiding to have that illness. But I would say that the value in it itself they're separate. They're two different issues that definitely have to be taken account of when looking at pricing.
One last question has popped up. It's not directly to the question of incentives, but let me take it and then we'll move on to your own roles. And it's one for you really, John, I think. Could EU for Health help to implement the implementation of the EU guidelines on the prudent use of antibiotics in humans? So do you see a role for EU for Health in the stewardship question?
Yes, totally, yeah. I mean, the Health Security Committee has decided a list of guidelines on prudent use. I think there's a huge gap between the theory and the practice. And that's why the Commission is actually funding at the moment national action plans on antimicrobial resistance through the health programme. And I think the future health programme will continue to do so. The level of investment is tiny compared with the cost of the problem. This is because of the nature of the European budget. It's only skimming the surface, I would say, in terms of the necessary investment, but it's showing a way that member states can actually save money. I just want to go back to a point that was made earlier on about cost effectiveness of new antibiotics and the price to pay and so on. There's a figure that sticks in my mind, which probably people in Gastein are completely familiar with. And that's the OECD estimates of the amounts that are spent on health systems and the amount that's spent on prevention. This breaks down at 97% operating costs of health systems and 3% on prevention. And everybody keeps saying every year in Gastein since I've been going that this is terrible and we must do something about it and it should be the other way around, you know. But it's actually not very easy to do, because if you're a health minister and you're trying to justify cutting up the cake, you'll have the patient groups going to you and saying, well, we need a new IRM, or we need new medicines paid for this particular disease, or we need a new clinic or whatever. So it's very, very difficult to try and shift these budgets around. And I think the other aspect which I'd mention is the issue of the slow burning nature of antimicrobial resistance. It's very lucky that it is so slow burning, I suppose. But if it actually were to arrive with the speed of coronavirus, then we'd have to change our way of thinking and our way of dealing with it, because we wouldn't be sitting around talking about pilot projects.
Indeed.
We'd be in full crisis mode. So we have to bear that in mind. It's a slow burning thing. And Sally Davis did her best during her time as Chief Medical Officer, also internationally.
Okay.
The profile, but you know.
Yep, absolutely. Just want to, sorry to interrupt you there, but I just want to come to you, and I'll come to you first on this question, because it's more of the who does what question. And you mentioned their patients, John, and I'm just wondering, you have a range of your stakeholders, as it were, on this panel with you, from the philanthropic to the academic to the industry side. What support do you need? What do you want from them if to help address this issue of incentivization and get it right? What do you want from them? And then to each of you, how you see your own role, and particularly because we haven't talked about them so much, the role of patient groups and civil society more broadly. And Jeremy, perhaps come to you on that first. But John, what do you want from these guys?
I think really an honest and open and transparent partnership to try and sort this out, in the same way as we've had this relationship now with the vaccine producers in the COVID situation. I think we all have to say that this has been a transparent, open process, and it's been dealt with in a very short time, of course. But I think we have to construct this sort of relationship where governments and pharma industries and researchers and the medical community can come together on this, rather than, you know, sort of discussing in different fora.
So that multi-stakeholder collaboration, absolutely key, Jeremy. And what drives the AMR Action Fund? It drives EU GEMRI as well. But for you, how do we make that collaboration really work? And that particular question of making sure that the patient's voice gets heard in all of this.
So I think identifying the different roles people can play is vital when it comes to collaboration. And I think we need to be clear that there's things industry can do, there are things industry can't do. Likewise, there are things government can do. And on the philanthropy front, I think we play a very important part in the ecosystem, but we can't do everything. I think we feel like we're giving our kind of greatest value, the greatest benefit to the system when we're focusing on funding the things that governments can't fund. So things like the very early stage, high risk innovation, or taking an approach that doesn't necessarily bankroll the entirety of innovation, but underwrites risk or somehow reduces risk. I think that's the best way to use kind of funds and philanthropy. I think when it comes to civil society and the patient voice, I think that's been a big missing thing in recent years in the AMR movement. I think when you look at how AMR has evolved as a policy issue over the past 5 years or so, it's extraordinary how it's risen up the public agenda or the government's agenda. And I think that owes kind of a lot to kind of very powerful, passionate advocates within government, close to government, and politicians themselves recognizing this is an important thing. It's not been this kind of bottom-up, patient-led thing. And I think we need to start correcting that. We can't necessarily kind of overnight create this new patient body of kind of AMR Patients United or whatever. But we need, I think, start tapping into the existing patient bodies, but we need to recognize they have skin in the game on this. The cancer charities, the diabetes charities, the old age charities, they will all see kind of massive decreases to the quality of life, the outcomes for the patients they represent, unless we get a grip on AMR. So we need to start seeing much broader ownership of AMR across existing patient advocacy bodies, I think.
And Janelle, same question to you, appeal there for John for this partnership, open, honest, transparent cooperation, partnership, and many of the actions we've been talking about have that at their heart. What for you is the key to make that collaboration work and the part that industry must play in it? Yeah,
I think we at MSD, since we're one of the few and there's not a whole bunch of industry that's involved in that, we have enjoyed, having very open, constructive conversations globally with the EU and other governments and being consulted on, does this work? Does this not work? Because we do understand these are very precious funds. And for MSD, we also try to play a leadership role in trying to align the other industries, biotechs, larger folks, so that we're all coming to the table, because we don't want this to be very complex for politicians. It's already complex as it is. So in trying to align us as a group, I think, for us, what is very important is that we continue to sustain the development that we're doing, but that we really do need to see action at this point. And I think to Jeremy's point, folks like the Cystic Fibrosis Foundation and those poor patients, I mean, this is deadly, but we have to make sure, that we educate and prioritize this on their agendas as they are talking to people. But I think, we are at crisis mode now. It is time. And so hopefully we, hope the European Union can really take the lead in this and really bold strategy, and the pharmaceutical strategy would be fabulous.
And Christine, for you, in terms of really making this partnership, this collaboration work, I say you very much a co-lead on one of the aspects of EU GEMRI, which is all about cooperating and it's looking for synergies and so on. What for you is the key? And then we'll try and draw some conclusions before we close.
Well, I think the key right now is to be there to assist the European Commission, as desirable, and really to help. We're there and willing and have 3 years of work now that we've put in, and are available to support the pharmaceutical policy and any other support that the Commission would like to see from us.
So great sense of partnership, a great spirit of cooperation here. But by way of conclusion, because we are almost out of time, I wanted to ask each of you, and I'm accepting here, Jeremy said, we don't have one single shot at goal. Janelle said there is no silver bullet. We have acknowledged time and again that it's complex, but you also called, Janelle, for bold action. So I wanted to ask each of you, if you had to identify a key next step, because we've said, you know, if we go on at the speed we have over the last 5 years for the next 5 years, and this crisis creeps up on us, and there is that tipping point, John says we're not there yet, it's slow burning, but it will come. For each of you, as we go away from this session, if you had one key thing we need to do, a priority for now, what for each of you would it be? And you have 1 minute each. I'm going to start, I think in reverse order to the way we started. So John, what for you, of all the issues you're addressing as a policymaker, is your key next step, key priority?
Well, I think the game changer must be the EU BARDA, because whatever we put in the pharma strategy, whatever we put in the research program, whatever we put in the health program, I think the real operational tool which could actually change the situation on the ground could be BARDA, assuming that we can make BARDA understand that this is #1 thing on their list, you know, and they don't have to start developing CBRN, antitoxins and things. Well, they can do that in their spare time, but I think the first thing they should do is sort something out on antimicrobials. And that's such a complex thing, I think that'll keep them busy for a few years.
Okay. Christine, for you, the key priority.
I couldn't agree more with John. I think really hoping to get antibiotics onto the EU BARDA agenda would be a huge success. And I do think that I know that we need action now, but I do think that a signal from the EU of going forward would result in some impact on the private sector, and really making sure that the small companies, we support those small companies so that they don't go bankrupt. I think that would be the two things.
Thank you, Jeremy.
So I think I'd agree that BARDA, the European BARDA, could be a game changer, but I'm very wary of putting all of our eggs in that basket. We can't rely on some sort of kind of new mega agency to pick up the whole of the antibiotics pipeline. That wouldn't be a desirable outcome. We need to keep private companies in there. We can't rely on kind of government agencies to do everything for us. So I think everything kind of comes down to getting the incentives right, getting a functioning market for antibiotics in Europe. And I think we need the kind of political leaders in Europe, some of whom maybe have been slow to kind of acknowledge the nature of a problem of the antibiotics R&D system. They need to acknowledge this isn't a question of kind of narrow industrial policy and doing things to benefit companies in some abstract way. This is about patients. This is about the very real threat that we will not have antibiotics in Europe, either because there is simply not the innovation taking place, or because it's not in the developer's interest to extend a registration from simply America and bring a product to the European markets. And it's inexcusable that we don't have more countries looking at what they can do in their national markets to break down the barriers to antibiotics, entering them, or kind of breaking down the barriers to better, fairer reimbursement that will ultimately kind of deliver things which are good value and bring benefits to their patients.
Thank you very much. And you bring us back full circle to that answer to my question earlier about what was holding us back, that lack of incentives. 2/3 of the audience said it. You've all said it. So thank you very much for that. Janelle, you have the last word. Your key next step or priority.
Well, and I do just want to say that I mean, very supportive of EU BARDA. I actually was the lead on the committee that wrote the US BARDA. I was the head staffer in the Senate that led my committee through that brought that into law. And, you know, one thing that we have seen with BARDA was that it has been helpful in the push incentives, absolutely, but we've seen the valley of death. So to Christine's point, it has been tremendously successful of growing 1,000 blooms of your biotechs, but they are not now getting across the pathway and dealing with getting to market. They are unfortunately many times going bankrupt. So I would say support the EU BARDA, but again, at the same time, I would really employ for patients of Europe that we could move on a pool incentive. And that really does need to be the next step to address the continuum here.
And on that note, I'd like to thank you all on behalf of the audience who can't thank you in the time-honoured tradition, so I will do it on behalf of all of them, for dancing with the elephants, going back to the overarching theme of the forum, tackling, we've all admitted it's a complex issue, it's a difficult issue, we know broadly what we need to do, we still have some unanswered questions about some of the specifics, so thank you very much to all of you. Thank you to the audience for being with us. Thank you for your questions. I managed to squeeze almost all of them in. And I would also very much like to thank the European Health Forum Gastein for having us and for their support with putting this event together. So thank you very much to all of you. May I wish you a very pleasant evening and stay safe.